hospitality. Everything looks very festive today. And Becky, thank you so much for the kind words. We thank you most of all for your leadership. And it's good to be here with so many partners in progress. That includes our fellow policymakers at the State House, Representative Randy Fry, good to see you again, and former Representative Cleo Duncan, with whom I served in the General Assembly. It was still during Cleo's time that we first started talking about this project and the great advances that could occur statewide. So always appreciate the good support we get at the State House level for implementing innovative and creative policies and practices. I am here today as part of my Hoosier Crossroads tour. And what does that mean? In the late summer, when you sit down to think about having 15, 16 months left in office, I decided that we should go on another 92 county tour. I say another because I've been in every county multiple times. This is my 7th official visit to Decatur County as Lieutenant Governor. But on this tour, our visits are structured a little differently, where I spend the morning hours meeting with the local elected leadership at the city, town, and county level. We have a facilitated discussion about how we can all work together to better serve Hoosiers, our mutual constituents, how the locals can create more partnerships and efficiencies by working together and by working with the state. So that went very well here today. You have proactive local government officials. And then in the afternoons, when I visit a county, we view some projects that have been funded or partially funded by the state, or some programs that have been supported by the state. And that brings us to this afternoon's visit, where we're here to witness the progress in Decatur County and at Memorial Hospital, and also with our Telehealth Network. I think many of you know, because you were here 14 months ago, that this is where we kicked off the statewide initiative. We held a statewide press conference right here in this room to tell all Hoosiers about the advancements we plan to make. And it was just 2 months ago that I and many of us in this room were in Williamsport at St. Vincent Hospital, then celebrating the most recent addition to the Telehealth Network. So we're very proud to see this network continue to expand and to serve more and more Hoosiers. I understand, and Becky mentioned too, that we have about 60 facilities online now statewide. And I think we all know that broadband is the most reliable way to move health information from point A to point B. And when we provide that level of communication to our healthcare providers, that takes this already excellent healthcare system to a whole new level of service. And bottom line is, this network opens the doors to doctors and to patients. It allows them to access specialty services, not only anywhere in the state, but anywhere in the country and in the world. We know that telemedicine makes it faster and easier to diagnose and to treat patients. And I've had a little update on this particular hospital. I know that you've made great advances by having a connection to IU Health, and particularly for your stroke patients now, you can provide faster treatment and more effective treatment. I also know that you're connected to mental health professionals in the Bloomington area. So these are great advances for the people of Decatur County and for this entire region. This network too could take away the need for more rural patients to have to travel to see a doctor. I think especially in our smaller cities and towns, can actually, the distance to an urban facility can actually be a barrier to getting the proper treatment. This telehealth network will take us a long way in that regard. We know too that the healthcare facilities that participate in telemedicine, they have a great return on their investment. And that's not only a return financially, but it's also a great return in the doctor and the patient convenience and in satisfaction. So I would just sum up by saying this telehealth network moves us light years forward for our rural communities, for our healthcare system, and for our ongoing statewide development. So I'm very pleased to be back here, witness the progress of Memorial Hospital, where it all started 14 months ago. So thanks so much for being here today.